And then the lower part is coming off of T4 to T12, and that's inserted down here in the bottom part of the spine of the scapula. So that part's going to be, it's going to depress it, and then it's also going to do downward rotation. Remember, that's the kind of rotation that makes the glenohumeral joint face downward like that. So this is going to be lower trap, this is going to be upper trap, this is going to be middle trap. And then levator scapula. In this case, too, the origin is going to be up into the transverse processes of the upper cervicals. And then it's going to insert right here. And that's going to be on the medial border of the scapula, above the spine of the scapula in the superior angle right here. Okay, so the insertion is going to move towards the origin, so it's moving the scapula up like that. And between the upper trap and the levator scapula, that's where there's a lot of people a lot of times have trigger points up in that area. Okay. Then you have the rhomboids, going to be here. Those basically go from the spinous process to the medial part of the scapula. You have the major and the minor. The minor part is going to be at the root of the spine of the scapula here, and then the major is going to be at the medial border here. And so it's going to move the scapula up and back like that. And then now we have the pec major, I'm sorry. And that's one of the landmarks you're going to use where it forms the border of the axillary fold. That's the muscle here. Okay. So the origin is going to be along the sternum, sternal end of the clavicle, the sternum, and then the cartilage of the first 6 or 7 ribs. And then it's going to come across to insert into the humerus. And the way that the fibers go is as it comes across here, it actually rotates. That's just a minor detail, it's not that big a deal. But so the pec major, you're going to have the, like they talk about the sternal part, so that action is going to be more like this, whereas then the lower part is going to be more like this. Okay? It's going to do flexion. Depends on what types of movement that you're going to be doing. I mean, it's involved in pulling up to do pull-ups. Although the lat's going to do a lot of that as well. So again, it's going to do flexion. It's also going to do adduction down like this. And then it's going to do internal rotation. Then you move to the latissimus, and that's going to come off the lower thoracics, and then also that same thoracolumbar fascia that we talked about with the rectus spinae muscles. Okay. That's going to be a prime mover of extension and adduction, also medial rotation. Okay. It's a large, big muscle. It's going to have to do with a lot of power of throwing and pulling down and doing pull downs like that. It's involved a lot of times with people who are swimming, doing this part of the stroke where they're pulling down, or power stroke of hammering, things like that. Swimming, rowing, things like that. And then the deltoid, and we'll go over that one. That's basically what's going to, like I said, you have the anterior part, and that's going to do flexion. And then you have the middle part, which is going to do abduction. And then the posterior part, which is going to do extension horizontal.